they themselves are sort of victims of their own aggressive tendencies. And that's something else I would like to move into is, what are these self-destructive tendencies? Because they do exist in people who suffer from psychopathy. It's kind of intuitive. I mean, when you think about it, if you're overly confident and you don't have a lot of anxiety, and these are traits that they also possess, and you're pretty grandiose and you feel pretty entitled, and you don't do a lot of planning, and you're impulsive and you just sort of throw yourself into things, you may get away with that for a long time, but eventually people might make really terrible mistakes financially or interpersonally. There's errors of judgment that are very hard to undo. And so there are ways in which it can become a very self-destructive way to live. And people who have psychopathy can suffer the consequences of their actions in really big ways, because maybe they're going to lose their job, or maybe they're going to end up with a lot of debt, or maybe they're going to lose the respect of other people. And if they're very concerned about image, or the sense of humiliation might be very great and very painful.
Why did you decide to get treatment?
I think the reason why I started thinking I needed help is because I realized that I did not have an alternative to manipulating. The only way that I understood how to interact with people was through manipulation. I didn't even know how not to manipulate people in my relationships, and that eventually kind of just always led to them having issues, and then having these breakups. It wasn't until much later that I started taking it more seriously. It was after like 5 or 6 years. I had, had some problems with my employment. I had some problems with various relationships, friends that broke up with me, other relationships that broke up with me, problems with my family. And I thought, there's a little bit of a pattern to this. Every 3 years or so, my life kind of just falls apart, and then I just, reinvent myself, go to law school, start a new job, do whatever it was. But I thought, I'm getting in my late 20s now, and at this rate, I'm going to run out of career options, and so this isn't going to work out for me. And so I remembered, several, the 5 years before, what I had thought about Sociopath, and I thought, this time I will actually look into it and see what I can make of it, see if it applies to me, see if I can learn more about myself, see if I can stop this pattern of every 3 years self-destructing and starting over again.
Because, if you say stop manipulating people, that's fine. But what do you replace it with? What do you do instead with regard to people? It's almost like stop manipulating people was a vacuum. I had nothing to replace it with, but you had to replace it with something.
The other thing that could be put into this category of self-destructiveness is there's a sense of not real relationships, which might create a sense of loneliness actually deep down. I mean, you could say maybe they don't care that much about relationships, or those kinds of intimacies don't feed and nurture them. They're not succored for the way they are for many people. But, when you get older, it's harder to pull off these sorts of characteristics, and there's an isolation that may come with having this condition.
So how do you view people and the world? How do you view people?
I used to view people, I think, in a very shallow way, where I thought, whatever is convenient for me is kind of how I'll treat them, or, I'll seek out people that I think are kind of convenient for me. And I would kind of manipulate them, for various reasons. And the worst part about it was that I treated myself that way too. If there was an aspect of my own self that wasn't convenient for me kind of to acknowledge, or I wanted to kind of get something from my own self, I'd manipulate my own self. I'd just kind of try to ignore certain aspects of my identity or manipulate myself in order to get what I thought I wanted. So it was a very the ends justify the means kind of way to live, and I just kind of thought like, okay, this is just how everyone works probably. I think that when psychopaths tend to struggle, it's usually because they feel like life is meaningless. And the reason why they experience that, it's kind of like this existential angst, like absurdism, which is, why am I making any of my choices? Why choose this versus that? None of it matters. So if that's what they're experiencing, mostly they don't experience that in the playground stage. So if they're post playground stage and they're experiencing that, then my advice would be to stop masking, try to be yourself. And instead, and I think, and I'm writing a second book about it, that the sense of meaning and fulfillment and purpose that we get from life comes at least in part from a sense of self-expression. Like we are living our life's purpose. We're living our life according to like the unique person that we are. And without that self-expression, things seem absurd and meaningless. This kind of pervades your experience of life, and it is, I think, because you wonder like, why am I, that you have no emotional, psychological connection to the things that you're doing. But when you self-express, you are connected to that because those things are you, so like even your daily life choices become this means of self-expression and kind of reinforcing you and your purpose and your existence. So that is kind of like a really tall order. I think like that's definitely not something that can happen overnight, but I think to think like, let's stop masking, because the masking is a big problem for most. It takes so much energy and it makes you resent the people around you. If you feel like you can't ever just be yourself around the people that you're supposed to love, or they're supposed to love you, I should say, then that can be really like grating, that can like really wear on your soul and make you kind of soul sick. Because you think, what's the point of any of this? So I would say stop masking. And then from there, just try to, as much as possible, to learn about yourself and to make your choices from a deep sense of inner preference and self-expression, rather than trying to make the choice based on kind of manipulating people or like a kind of a quick fix or a quick pleasure or a quick anything, as long as I guess the real kind of motto would be like, try to be as 100% you 100% of the time.
There are several treatments and they basically fall under the category of cognitive behavioral therapy, which is about not so much shifting the inner life and the perspective and creating deep insights. There's a little bit of that that we do in traditional psychotherapy, although some psychotherapy can be helpful, but really creating a behavioral change, a way of changing the way one relates or moves in the world. So basically it's not so much about changing it, removing it, but containing it, controlling it, managing it. A couple of therapies that are considered successful with this might be schema-based therapy, which has to do with understanding concepts of the way relationships happen, the way scenarios happen, and shifting the way one thinks about that. Then there's transference-focused psychotherapy, which is very similar. You're dealing with the internal life with sort of what we call dyads, or relationships that exist within the person in their psyche, and shifting how they manage those relationships, perhaps creating behaviors that are more empathic, more attuned, the person would develop a greater ability, hopefully, to what we call mentalize, which is understand what's going on inside another person and in their world and what's important to them. People can be taught to manage their own behavior. And one of the things too that's interesting is that punishment doesn't work so well. It doesn't faze them all that much, but rewards work pretty well. So they get excited about getting what they want, about the reinforcement, about the input. Could be if you're in a, on a ward or even incarcerated, maybe gifts or, cigarettes or ability to have another phone call. These kinds of things are much more motivating than negative and punitive responses. So for children, I think we can be very hopeful, much more hopeful than we used to be, because they're malleable, they're impressionable, they're still developing, their brains are still developing, and environmental influences can be helpful.
And I want to get more information from you about therapy, what you
Okay.
found was useful, what types of things that your therapist has you do, if you don't mind sharing.
No, it's fine. Well, the first thing we had to do is I went in. I was introduced, and she said that we'll look at your behaviour in the past and what you're doing with, and how you deal with stress or major situations. So, my father died about a year ago, and I had a complex relationship with my father because he was a very, I think, quite an intuitive person. He
Mm,
was very sensitive, which strange enough wasn't a good thing to be in Glasgow when he was young. So
right.
he'd built up quite a lot of walls, so he could be very aggressive. And being aggressive with someone like me can be quite volatile.
Hmm.
So she goes, how she goes, so she did, so she said, okay, so pick something in your life that you think is a significant event in your life that you think shaped the person you are. And then what did you think of that? What did you feel of that? And so we went through some bits and pieces on that, what I felt about how my dad died and how I was affected. And I had tended to stay away from the family during this time
Mm,
because, like I said, I tend to withdraw, and they were all having quite an emotional time of it because we've got a large family, and he was like papa to my sisters who have like, you know, I think I'm a granddad now. So she asked me how I dealt with that, what I felt, and she also asked me things like, are there areas in your life where you'd like to see a change? And so I couldn't think of anything off my head. I was pretty terrible at therapy at the beginning
hmm.
because I didn't really know how to open up and I didn't really see the value in it.
Right.
Over time, she was very good at gradually taking me through it. I mean, I think 18 months might be a long time for some people, but to me, that's how long it takes to get me to be open. The benefit of it is the conversation we're having now.
Mm.
I would never have had this before therapy.
In what
I would
way?
just, well, I would have seen it as being an exposure. I mean, I never ever spoke about myself in any context, even stuff like they say, what did you do in the summer at school? I would always make it a story, like I
Ah,
was kidnapped by aliens or something.
uh-huh.
I'm never very good at opening up exactly what I'm thinking and feeling at the time. And I think it's a defense mechanism because there's not a lot there. I don't have those intense things to portray. So we examined that. We examined, she said, what do I think about things in general? We did some general stuff, and she asked me to take instances from the past, as she said, and then an instance from the future, and compare them to see how I'd maybe changed over the years. And eventually she said to me that this process was because she was trying to get me to accept the fact that my level of self-awareness was low and
Mm,
that I wasn't really aware of what I was being motivated by,
yeah.
which to me seemed like the opposite because of the way I was. I always had presumed that I was in the driving seat all the time
Yeah.
and that I wasn't being influenced by anything that I didn't control.
Right.
And so I came to the realization that I was making the same mistakes over and over because of the nature of my psychopathy, basically. Okay, well, I'll give it some thought. Well, what I'll do then, because I know I'm obfuscating a bit here as I do, I'll take you through a typical session.
Hmm.
That's probably the best way to do it.
Okay.
Yeah. So we'll turn up at the office in normal times. We sit down, exchange pleasantries. She keeps them to a minimum for me. And then which she'll say something like, she'll probably go straight into an exercise, something like, what in the last week, something that happened, would you do differently now as opposed to then?
Mhm.
So I would find an incident of some description, and then I would look at how I'd do it differently if I wouldn't do it differently. And she'd ask me, why would you keep doing it the same way? Is it a good thing or a bad thing? And then she might ask me what else I did that week, anything else she thinks of interest. And then she might ask me something more specific, like I mentioned last week, something about sex and intimacy. And in one case, she said, do you think all sex is intimacy? And I said, for me, sex never contained much intimacy. It was just the act was pleasurable, and that's why I did it. So she would say stuff like, do you think that's intimacy in anything? So I would, from there, I would move on. And I'd say, well, nothing pretty much is what I would call an intimate situation, from what I understand other people to mean by that. So the only person I'd say I was really intimate with would be my wife or members of my family on certain occasions. And then she might ask me, do you think that's what other people do? And I would either say yes or no, depending on what I felt at the time.
Mhm.
So that would be the rough structure of how he does it. There would be different things. Sometimes she would put exercises in if I said or did something from previous events. She sometimes asks about like world affairs and generalities, and sometimes she'd ask about specifics. And she said that's to try and get different perspectives on things, so that she'll get me to open up, and then she can work with whatever it is I tell her, basically.
That's really interesting. I can kind of see a little bit what she's trying to do, and just trying to get you to review the week and what would you do differently, because she's not telling you to be a different person. It sounds like she really is trying to kind of get you to self-reflect a little bit more, and to think, what is your true preference about how the week should have gone? Not like, it's in the past, it's over and done with, but like, how do you, in a way, how do you feel about it? It's
Yeah,
like a
very
really
much.
clever way to do it.
And she said she had to come up with it pretty much for me.
There are a lot of things that have gotten better since I have gotten treatment, since I've been seeing a good therapist. The thing that I found most helpful about therapy was, all of my life, I had never really felt self-expression. I never really felt like I had self-purpose or a sense of self-fulfillment, because I really had such a weak sense of self. All my life, I had kind of felt like a cipher, almost like, like a gas or a liquid that just occupies the space that it's in. I thought I fit in everywhere, but I really am nothing. If there's nobody around me, then I am nothing. Kind of like a chameleon, except the chameleon disappears when there's no one around. Or like kind of a hologram or something. Like, you have to have the right situations in which I would appear. I would say after I kind of reintegrated kind of forgotten parts of myself into like a sense of self, into a sense of identity, because now I do. Now through therapy, I have like a sense of self, I have a sense of identity, I have self-expression. And because I have that, I think that my emotions, I have more complex emotions, right? Before it was all the primary ones, like anger, frustration. I have a friend who went to kind of a therapy kind of like group session, and they were supposed to write down 3 emotions that they always recognize. And I think she wrote down happy, angry, hungry. And her partner in the exercise was like, hunger is not an emotion, but it is a feeling, And if you're kind of like psychopathic, then that's kind of where you're focusing, is like, this is what I recognize about myself. Those are the actual feelings that I feel regularly and I can recognize about myself. And then once, so that's how it was before. And now that I have like this sense of self, I think that because a satisfaction emotion, is a little bit more complex. It's way more complex to feel, for instance, fulfillment. In order to feel fulfillment, you have to have a sense of self. You have to, like where you are in life. There's so much context and nuance to it. And you really aren't able to feel that sense of fulfillment until you establish that sense of self. So after I did establish the sense of self, yes, I had like I don't know if it's the full palette of emotions, but it's way broader than it was before. So I do feel things like devotion, I feel things like loyalty. I feel things like disappointment when, you know, people do not live up to their end of the bargain. You know, all these kind of like social like emotions that you would have in reaction to somebody. I'm finally experiencing these. It's been hard to get better, and now it's hard to have emotions. It's great, but it's also hard.
Like I don't mind being tied to weakness now.
Okay.
I guess post therapy, yeah. I'm like a dummy, like an idiot on a show like that. I have all sorts of weaknesses and vulnerabilities. Like I'm barely scraping by most days or whatever. You
Yeah.
know?
I'd never like to interfere too much with people's identity development. And it sounds like you are going through not identity development so much as, I guess, strengthening. But this type of thing, I
Yes.
never like to mess with. And I think good therapists never try to mess either. But I think
Mm.
one thing that's been interesting to me as I have strengthened my own sense of identity is that I have gotten a sense of intuition, which I never had before. But
Ooh, yeah,
yes.
okay. So yeah, I suppose if you think and start to pay more attention to people, that you will eventually develop a kind of awareness. You were saying earlier about how you'd be able to compare your experiences with theirs, and it would be. What's interesting is the origin of intuition, yeah, because it's yeah, that's interesting. Is it a learned trait or is it? I assumed it was innate because I didn't have it, but I suppose again it comes down to what makes psychopath. It's probably a combination of a genetic tendency and whatever happens in our backgrounds.
Right.
You know, are we born or are we made? It's a bit like I think it's a bit like being gay. I
Yes.
think you are that way, but whether it's strengthened enough to become your predominant trait or not depends on your upbringing and your experiences.
Yes.
So that's interesting, yeah, because I'm fascinated by it because I don't have it, but I do know it's real. I do know intuition is real. I mean, I can't explain it, and I certainly wouldn't like to risk it. But I've seen people do it. I've seen people do it. I remember I was in Vegas, and this old lady used to. It was probably something to do with people said that she maybe subconsciously seeing the tumblers turn, but knowing how these machines work, they build them specifically so people can't do that. And yet she could tell they roughly paid out every 15 to 20 major spins. And I watched her, she could tell which machine was going to roughly pay out within a few coin stuff. Now she'd been doing that for a long time, but I watched her carefully, and it was amazing to watch because she displayed other things as well. Like she phoned her friend who was in the room because she said she was upset, and this was like magic to me. I said, "What? How do you do that?" And she was, and she goes, "You get to have a feeling for other people, how they act and how they are." So, but she's in another room, so I do know it exists. I can't explain it, and I haven't felt it, but I do know it exists. That people can develop intuitive senses for things. It's fascinating that you developed it. That's really interesting.
Yes. And in my own experience, I would say that it was a little bit like how I used to not be in touch with my body, even, so where I was like sick with appendicitis, but was just still kind of moving along, not going to the doctor. And similarly, I think that I always did have some intuition. Maybe it's a higher level or lower level than other people. I don't know. But then I just started to learn to identify with it. So I think it was there all along. One thing that kind of prompted me to do this perspective shift that we talked about, where you kind of start to see people as being more real, people just like you who have inner worlds that are just as authentic as yours. The shift was in part prompted by like this sense of like, who cares if I do anything, because like, so I, kind of talk about these stages during my playground stage in my 20s, mostly early 20s, it was like, I didn't care. Everything was just new. And I was going from, university to law school, and then law school to working, and, moving different cities. And it was just all kind of exciting. And I kind of didn't care, I was like having fun. And then at a certain point, I stopped kind of moving cities as much. And then I was just stuck with being in my same profession. And I do think I was you know, I could say I was getting bored, but ultimately I think I was feeling like there wasn't any real reason to be doing
To
anything.
continue. Yeah, directionless. Yeah, I did say that. Yeah, I did notice that. I would say, because I've compared that with empathic people, and they have a consistency that
Mhm.
I don't have. I do envy that. Like you said, some people are like, I believe in this. I'm this type of person, and they're
Mhm.
that type of person forever. If I say I'm this type of person, it'll probably last about a week if I
Yeah.
really push it, and then I
Mhm.
start doubting it. And I like the idea of the meaningless stuff because I've done that. I even turned to look at philosophy for a bit, which was interesting in its way. And that because I thought, well, does anything actually mean anything?
Right.
I mean, the only reason, like you said, about different perspective, I was looking at, well, other people find meaning in things I really don't find meaning in. And I started to look at them as, yeah, I see what you mean, fixative. I started to look at them as other than just objects, cycles. Because somebody once said to me, do you objectify women? And I said, I objectify everything. That's how I tell things apart from each other. And it was in jest. I actually meant it. I labeled everything because that's how I knew X was Y. And like you said, I started to think that is that is that really all there is to it? That smartest man in the room thing? I pretty much have that whenever I walk in a room.
Mhm.
That's partly because of my nature, but partly because I really am smart. So I started to always judge people that way. But that's a very one-dimensional way to look at the world, isn't it?
Yes,
Because I didn't
because who
judge people
cares?
yeah, I didn't judge people by other traits. So I thought, you know, and also I looked at some my therapist found them really good. She said, you clever, yep, you've said that that's your thing. Do you think other people have things that are as valuable or more valuable than being clever to society?
Hmm.
And I thought, okay, well, possibly. Because immediately I go to me. So I start looking at what I have other than that. But then I started to think that she goes, could you relate that to other people? And she's very good. She said she does explain, I'm using the word relate to the people as a way of communicating. I don't expect you to suddenly turn into some kind of empathic individual who's going to sense everything everyone does.
Right.
But she wants to look at, is it possible that other people have viewpoints that have equal value to yours, even if they don't come from a place you could recognize as having value?
Hmm.
And so I thought about that for a while, and I thought, well, I suppose it's possible because there are lots of things in the world that exist that for various reasons that I don't particularly adhere to, but I know they have value. Because I remember I was talking to someone online, and he was one of these aggressive atheist people
Mhm.
who wanted to make everybody give up all their religions. And I thought, well, why would you want to do that particularly? I mean, I don't care. People can believe what they want. I don't have any issue with that. But why do you feel that you could somehow make the world better if you took that away from everybody? Like, again, you said about their argument having some reinforcement. So I like to argue against people anyway. So even though I wasn't particularly religious, I argued the religious case. For example, without religious organization, we wouldn't have got out of the caves. You
Right.
know, we'd still be throwing spears at each other. So there is value in that particular way of looking at the world in those particular institutions. And so you can't just say they're all negative or they're all positive without some kind of support for it. And like most zealots, he got really annoyed at me and started to get irritated. And so I just sort of kept pushing the point. I said, well, we can't have a single view of things, which
Yeah.
for me was quite a breakthrough because I do have a single view of things. I mean, if I don't think something's relevant, like you said, I don't care. You know, I don't care. I can just pass through it all. So that was where I think I've shown some growth.
So what my therapist had me do was this thought experiment where he said, you know, imagine that you are the only person in the world, you know, about a particular decision, like where to go to lunch, let's say. So just imagine you're not trying to impress anybody. You're not trying to guess what somebody else wants. You're not trying to, you know, think about like their commute or whatever. You're just going to come from like a place of true preference, your personal preference about this. And kind of just when you imagine that there's nobody else in the world, there's nobody else's reactions to manipulate or to guess at or to predict or anything else. And so that was like a really good way for me to kind of learn how to stop manipulating, is just to be myself, you know, try not to affect people all the time or kind of manage people all the time, but instead to just be myself. And that's probably the biggest change from therapy, is now I'm just myself. I allow other people to just be themselves. You know, I respect their personal boundaries. And so I don't manipulate people at all. In fact, I'm kind of like almost like hypersensitive to it. You know how like alcoholics can't even be around a bar or whatever. Yeah. I like don't even come close to trying to manipulate people. Like I'll even specifically be like, you know, you like do whatever you want or whatever in this particular situation. Like I can express my feelings about this, and then that's it, and just kind of like let go of what ends up happening.
All right.
Which again was clever how she did that, because talking about now, had she tried that approach in the first few months, I probably would have shut down, or I'd have started playing games with her and just fed her answers that she was looking for.
Yeah.
You know, looked up whatever. But she was very clever though. She avoided using specific methods, and she avoided using specific schools of psychology, because she knew I'd go and look those up, and then I would start playing with them. But I didn't, though. I have to admit, I didn't. I did try to make it work.
Think about how to treat psychopathy. It's a little bit complicated because it's not a condition, a way of being that can actually be totally removed.
There's treatments for personality disorders, and I think you mostly treat it like if you treat the personality disorder part of it, then you will like get a long way in terms of treating the psychopathy. You know, I can like to go back to what I said at the beginning. It's not like the therapy made me normal, but it probably did make me undiagnosable. Like there's still certain things that I'll probably never get back because just my brain, you know, like missed certain windows of opportunity to develop a particular way. And now it's a little bit stuck, you know, so I won't feel effective empathy probably, you know, never in my life, but I've gotten better about cognitive empathy. You know, I've kind of like through therapy gotten better at what's called perspective taking, like putting myself in somebody else's shoes. Yeah. And so it's like a little bit of a prosthetic, you know, for effective empathy. You know, I can still get by, I think, and live a happy, productive life, have good relationships with it. So I probably am not currently diagnosable anymore with maybe any personality disorder, or like right on the cusp, a wobbler. And but there are other things that I still have, you know, like I still don't have like the effective empathy, you know, where your brain just automatically kind of responds with, you know, you feel, I guess, the way that other people feel. So I think to say that there's no treatment, it's not like they've proven that there's no treatment. They just haven't found a treatment. But have they tried? What have they tried? I'd like to hear what they've tried, because it seems like they haven't tried very hard.
For